As Ontario's healthcare system is facing staffing shortages and closing emergency rooms, doctors are warning of a bad flu season ahead of the new school year. This as Canadians continue to live with COVID. For more, we are joined again by the president of the Ontario Medical Association, Dr. Zacharias. Welcome back.
Thank you so much.
What is the COVID outlook for fall?
So when we look ahead, we know that this is the first year that Canada is dealing with both COVID and a regular flu season. So first and foremost, getting up to date on our vaccine series is really important.
And what about flu shots?
Flu shots, absolutely. I mean, we've been looking to our neighbors in the South, South Africa, Australia, to see what were they dealing with in their flu season. It's often indicative of what we can expect. And so they had a bad but short flu season. And so getting our flu shots is really key.
Over the past 2 years, we've had low flu numbers. That's due in part to physical distancing, masking, where everybody's very conscious about washing their hands, not coming to work sick. Without these mandates, without these measures in place, or at least not at the fore, what are you expecting to see for our flu season?
So we are at this state in the pandemic. Leaning into our public health experts is absolutely key. Getting caught up on our routine school-based immunizations as well is going to help alleviate the strain on the healthcare system. So vaccines, 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 our COVID series, our flu shots, as well as kids getting their measles, mumps, rubella, hepatitis, and polio shots as well.
Yeah, speaking about kids and school, back to school. If you don't have kids in school already, it's coming up a few weeks from now. 1 in 4 Canadian kids are behind, we know, on those routine immunizations. What are the implications of that?
So we need to better understand even which, we know that families living in poverty have a lower uptake on their vaccines, and we need to be reaching out and understanding in order to bring those families also up to date on their vaccines. And so we know that the healthcare system is under tremendous strain. Protecting ourselves, our families, and our neighbors with being caught up on those vaccines is going to prepare us best for what's coming.
When you described the cases that you were looking at in South Africa, in Australia, as bad, what does that mean relative to Canada? What would bad look like?
Well, we know that every fall we have an uptick in admissions to hospital, people getting a bit sicker, viruses travel more easily when we're indoors and with each other. Even though there's not a mask mandate currently in place, following public health guidelines, washing our hands, putting on masks if we're indoors for a prolonged period of time with vulnerable people, elderly, in the same room is still recommended. And so all of these things are going to put us in a good situation for the fall.
If we do see an uptick in COVID-19 cases come fall, can our healthcare system handle it?
Our healthcare system is under tremendous strain. Emergency departments are overrun. I've been an emergency room physician for 20 years. I never believed that we'd be in a state like this. Healthcare providers are burnt out. We have doctor and nursing shortages. So Ontario's doctors are committed to working with government to implement solutions. We need them urgently to bring good healthcare to every Ontarian that they need and deserve.
I want to ask you about a conversation I had recently with an emergency care doctor in southwestern Ontario. And I said, what's the best solution here, after he outlined some of the problems? And he said, do you want to know the truth? I said, yes. And he said, don't get sick. That's a really, from the patient perspective, that's a really scary bit of advice to just, we're in such a crisis that we can't afford to get sick.
I'm not surprised he answered your question that way. Emergency room doctors, nurses, it feels differently practicing inside the hospital. And that's why we need to strategically focus on the solutions. We have a 5-point plan. We're calling it our prescription for Ontario. We are committed to working with every level of government to see these solutions implemented. It's really important to act now.
I want to ask you then about mandates and about protocols. We heard lots about protocols in the last 2 years, especially for kids and for teachers, right? Close environments, lots of opportunity for spread. But if we're trying to not get sick, and if we're trying to preserve our healthcare system, do we need some of those mandates and protocols back in place during intense periods like cold and flu?
So it's always important to lean into, when we're asking ourselves a question like this, what are the public health experts saying to us? It's hard to kind of sort through all of the most up-to-date information and figure it out. That's why meeting with your family doctor, your nurse practitioner, and I say that, you know, a bit.
Knowing that a lot of people don't have a
Absolutely. Over 1 million people in Ontario don't have a family doctor. That is a problem we need to address. But those are the appointments that we need to make to better understand where are we at with our COVID series, how to get our flu shot, and for the kids to catch up on their back-to-school immunizations.
Listen, when we're doing all our back-to-school preps, this is one of the things that we should be paying attention to.
Absolutely.
Thanks for coming back in.
You're welcome.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.